on call in the hospital. Healthcare workers of Reddit. What is your nastiest, strangest, most amazing work story? You'll start. Story 1. I'm not a doctor, but my roommate's sister and brother-in-law have some great stories from rural Australia. During one day in the local hospital, a man came in saying he had lodged some beads, or some sort of similar artifact in his brown cavern. So, routinely, they decided to get some x-rays to check on its progress the wrong way up his digestive system. They took the patient, let's call him Man, through, got him scanned but found nothing. When confronted, Man said that this had happened before and that the reason it wasn't showing up was because it was some sort of plastic silicone hybrid that was difficult to see on the x-ray. So, the next step was to grab some gloves and manually search for it. The man dropped his DAX and they were underway. After a couple of minutes of not finding anything, the doctor looked at the patient and realized he was sweating and smiling. Turns out there was nothing there. He was just a horny that wanted a doctor sticking their fingers up his anus. TLDR, man wants cavity search in here. I remember in my first year working on a monitored area on a med-surg floor, a young male patient arrested and we started CPR. One of our orderlies got on the bed and started chest compressions, and after a few seconds, a cardiac rhythm came back and the patient woke up, looked at the orderly pressing on his chest and said, "Get the F off me," and then passed out a few seconds after compressions were stopped. The monitor read asystole. Everyone around the bed was a little shocked, but the doctor running the code then told the orderly to resume chest compressions. After maybe 5 to 10 seconds of chest compressions, the patient wakes up again and looks at the orderly, tries to push him off with his arms and say, "I told you to get the F off me." The orderly slid off the bed and the patient passed out again after a few seconds and flipped back into asystole. The doctor yelled at the orderly to resume compressions and to not stop unless he says so. So basically, 2 nurses had to hold down the legs and feet of a patient that was awake while an orderly did chest compressions on and off. Pretty strange. Story 2. One time I had a female patient admitted for alcohol intoxication. Her blood alcohol level was 0.56. Since she was an alcoholic, her body tolerated the levels and she was still somewhat awake. We had to place a urinary catheter. Every time I went to place the catheter, she would start gyrating. I'd have to stop due to uncontrolled giggling, and then she'd yell, "Come back here, don't stop." One of the most uncomfortable situations in my life. Story 3. My aunt was preparing to operate on an old Greek man with a long history of smoking and what was believed to be a large tumor. After opening him up, they discovered the tumor was a sponge. It had been left inside him after prior surgery in Greece. Story 4. I'm a social worker who does psychiatric intake in an ER. Last week, I had to assess a patient with paranoid schizophrenia. The remote controls to the televisions in the ER have a cord, similar to a phone, so patients don't walk off with them. When I walked into his room, he was talking into the remote, like it was a phone. He goes, "I got someone in here who wants to talk to me. I gotta call you back," into the remote. Then he hangs it up and goes, "Sorry about that, business call." Story 5. As someone who has held many different positions in an operating room in a county hospital and seen the fattest, grossest, dirtiest, sickest, foul-smelling, covered, blood-spewing, unbelievable stuff with which I could go on for days, I recently experienced something I will never forget. My first full organ harvest from a still-living patient. She was 29 years old, with 2 kids, 7 years and 8 months old. She decided to shoot herself but only left herself brain dead in our ICU. The family made the decision to donate. We prepped the OR with perfusion equipment, cold slurry and a huge instrument set up. We bring her into the room and she's still alive, still under anesthesia and being monitored. A quick prep and drape and it's on. An incison is made from the top of her sternum to the top of her vagina. One team cracking the chest and making their way to the heart while another team begins dissecting down to the abdominal organs. As we clip and tie off the heart valves one by one, we are on the phone with surgeons in Phoenix making sure they will be ready for the heart when it gets there. And then it happened at 1,514 hours. I will never forget that time. We cross-clamped the aorta, tied it off and cut. That was it. Anesthesia shut off their machine, stopped their IVs and left the room, officially dead. The heart was handed off and packed, and the second they got it out the 2 cardiac docs broke scrub grab there and were out of there, onto a chopper to get the heart to their partner an hour away. The other team remained and we took 2 lungs, 2 kidneys, spleen, liver, femoral arteries and tibialis tendon. It's a very strange feeling to be working in an OR and not hear the ventilator working or hear the EKG beeping. It's an eerie silence. We finished up, threw in some quick stitches and that was it. A quick wash off and we pulled the rest of the lines and put her in a body bag and into a freezer. It was truly an experience to burn into the memory banks. Story 6. I worked on an ambulance in Seattle for 4 years. Got called to a house one night for a welfare check on a 60-something guy bedridden after knee surgery 8 months earlier. Place was a crack house with garbage everywhere. We went to the second floor and found the guy in a bedroom filled with cigarette butts, beer cans and mags. Room stank horrible, coffee cans filled with and everywhere, lots of flies, and baby flies. We rolled him over and found his white sheet was stained black like the whole thing had been drenched in tar. His backside from shoulders to was rotten and completely raw, visible spine and pelvis. His wounds were filled with mounds of white maggots which probably saved his life. We called fire department to carry him out and took him to ER. TLDR, guy bedridden and neglected for 8 months had raw open wounds filled with maggots. Story 7. I once arranged home care for a woman who had used caulking to make her own Needless to say, she couldn't get it out and needed a resection to remove the caulking from her intestines. Nothing like a huge scar to remind you of your own stupidity. Story 8. My favorite was in our ER in Iraq, beginning of 2004-ish. A guy comes in, brought by his buddies, having seizures and massive arrhythmias. We're freaking out, thinking it's some kind of chemical weapons exposure. After hooking dude up to a monitor, we see he's in VFib or rhythm use shock, and have the pads on him already, so start charging up to shock him, as well as calling everybody and their mother in there to deal with what is looking to be a massive clusterfuck and possibly requiring the decontamination team. A few seconds before we're ready to hit the kid with a few hundred joules of electricity, his friends catch on to what's about to happen, and start screaming for us to not shock him. What? We ask WTF is up, and find out they're from an engineer unit, and someone had dared the kid to eat C4, yes, the plastic explosive C4, that one. The one that's totally inert and safe until you apply an electric current to it, and then it explodes a lot. So, here we all are, mostly in need of clean scrub pants, and only seconds away from causing the worst medical disaster since Octomom's OB decided against euthanasia. All we're thinking aside from OHSHIT is, well, what the do we do now? In the end, we get the kid into the OR for the surgeons dressed in Kevlar vests and flak helmets. A sterile field right now to open up the kid's stomach and pull out whatever C4 he hasn't digested yet. In the meantime, we get on the sat phone and call poison control in the US. They hung up on us twice, thinking we were with them, before we got a supervisor who would help. Seriously, this happened. As it turns out, C4 is bad to ingest. You can absorb it into your bloodstream, but can't get it out. It basically creates plugs in all your veins and arteries, causing widespread damage. Think DIC after a mismatched transfusion. Medical folks, and the kid's probably dead but doesn't know it yet. He died on the plane to Germany. Nothing we could have done, honestly, but it still sucked, and there you go. Craziest I've ever seen, and almost got blown up by my patient while trying to save his idiot life. Sometimes it doesn't pay to get out of bed, man. Story 9. My wife was a resident at a county hospital in a large city in the Midwest. She had a lot of foreign body stories. My two favorite ones: one, 30-ish guy came in with his mom. He had a raw potato up his butt. His mom actually said, "I don't understand. He doesn't even like potatoes too." Middle-aged guy comes in with a bat, the flying kind that had died in his rectum. His story was that he had been taking out the trash when it just flew right up there. He then had waited 3 days, hoping it would fly back out. One of the other residents suggested sending in lemewinks in after it. Story 10. I work as an auxiliary nurse, and a couple of years ago I was on a renal ward. Patients that require dialysis have a fistula in their arm made up of an artery and vein joined together, and sometimes these can burst, producing a proper arterial spray. So it's afternoon visiting time, rooms full of families, and I hear a shout from a 4-bedded room. I run in and this old man tells me his fistula has burst. I don't register what is going on quite quick enough and ask him to show me what has happened. He then pulls his hand away from the inside of his elbow and unleashes a nice stream of blood that shoots out, hits me perfectly center mass, stains the whole of my uniform top completely, before I can shout at him to cover it again. Other nurses and doctors rush in to deal with the problem. Curtain is drawn round and I'm standing, covered in blood, sheepishly smiling at all the horrified visiting families and trying to sneakily wipe away the pool of blood that is slowly seeping out from under the curtain. Eventually he's taken away to have the fistula surgically repaired and we clean up the bed space. I need to go get a clean pair of scrubs obviously, so I go to take the elevator down to the surgical levels. By now it is the end of visiting time, so the lift is packed with families from different wards and I am very unsuccessfully trying to cover the massive blood stains all down my front. I think I scared quite a few people that day. TLDR, got covered in blood, scared a lot of visiting relatives. Story 11. I wasn't working in a hospital, but I was camped out at the admin station in an ER once compiling admission stats for the previous year. They brought in a huge Samoan guy, probably 350 pounds, had hurt his back somehow and was in a lot of pain, wheeling him on a gurney. There's only about 10 feet and a curtain wall separating me from him, so I can clearly hear him say, "How am I going to take my?" And the nurse says, "I'll bring you a bedpan." Now I've never used a bedpan, but crapping lying flat on your back is probably a chore. Combine that with a painful back injury, then round it out with 350 pounds of Samoan grade A beef, and you know it's not going to end well. A couple minutes later there's a grunt, a kind of clank, and an overflowing bedpan comes shooting out from under the curtain, skipping across the ER floor, leaving a trail of splatter behind it. There wasn't a solid piece of in the pan, it was like it was filled with chunky pudding. The smell was overwhelming, nurses were gagging, nurses couldn't take the smell, that's how bad it was. Even after they mopped it up the whole place stank. Eventually a nurse started handing out spray cans of mosquito repellent. The closest thing to air freshener they could find. We'll call him Derek. Derek was an older man that spoke like James Lipton. He would tell me at great length about his elocution, his exquisite diction, his prose, even when I was changing his catheter bag. One day, probably suffering from caffeineism and maybe a bit grumpy that my coworkers kept asking me to change Derek's pee holster, because you said you don't mind. Derek, in his beautiful oratory, said, "Excuse me, son, but you're hurting my..." Have I told you about Proust? Many years ago when I worked as a nurse's aide in a nursing home, a nurse called me in to assist her in catheterizing a patient. She lifted his gown, lifted his small penis and picked up the catheter. Before I could blink, his penis had sucked away from her fingers and literally vanished into the man's abdomen. I mean, it was gone, nothing left but a dimple. She excused herself and didn't return. When I went to look for her, I found her standing in the medroom laughing so hard she was crying. TDIL, some men have retractable penises. Story 12. Hi, ER doctor, attending physician supervising doc. Over the loudspeaker they call for an attending to bed 1, bed 2. They're next to each other in one large resuscitation room, and I have a sick patient in one, so naturally I think they must have taken a turn for the worse. I rush in and ask what's wrong with that patient, and the nursing staff say that yes, he's doing much worse and appears to be herniating, brain swelling to the point that it exits the skull base and squishes important regulatory parts of the central nervous system. But no, the reason for the overhead call was the new patient in 2. The new patient in 2 is in severe respiratory distress, and the resident is preparing to intubate. I ask the nurse for the patient in 1 to start hyperventilating, infuse mannitol, and page neurosurgery, and then I start coaching the resident for the intubation. Immediately afterwards, in the seconds during which we're standing around, smug, I notice what looks like a wet patch on the respiratory therapist's jacket, and then another, and I look up and notice that there's now a nice trickle of water coming down from the ceiling, and then a torrential downpour of warm water. It's at that point that the patient in 2 goes into ventricular tachycardia, and the tech, now an old friend, is standing over her chest with cardioversion paddles, a stricken look on his face, asking, do I shock her, while we're all standing in an inch of water. At this point both patients are soaked, there's water everywhere, huh? Let's check for a pulse, I say, which fortunately she had lidocaine. This was years ago, and then we will both patients out for drier grounds. Later, I learned that you can safely cardiovert patients in standing water. The EMTs here probably already know this fact. Also, our emergency department is below the hospital cafeteria. Dishwasher broke and spilled its contents on us. TLDR, 2 coding patients. Dishwasher pours water on us while we consider electrocardioverting one of them. NB, it's difficult to write these stories without getting crazy jargony. Story 13. As a green EMT with only about 6 weeks working experience, I climbed under a car at night in the pouring rain to try to take a pulse on a patient who had been struck and dragged about 100 feet. It was a super chaotic scene and I didn't have a flashlight, so I didn't realize the full extent of the patient's injuries until I was under the car with him. Basically, his legs were bent out sideways at his pelvis and flipped up so that his feet were near his head. He was very clearly dead. I had never seen such traumatic injuries and quickly scrambled out from under the car. I still remember that every time I squeeze under my car to change the oil. Story 14. My friend works in a hospital and was helping an old lady walk to the bathroom. The old lady was about 90, and as my friend was walking behind her she proceeded to sneeze and the lady projectile shitted all over my friend. There was even an outline of her body on the wall. TLDR on the wall. Edit the TLDR. Fix a period, middle of the night. A long-term geriatric rehab floor. They don't have high-needs medical clients. Usually, a guy in his 80s buzzes to say he can't go pee. Bladder is huge and distended. The RN tires to put in a catheter and can't. Tries again. Still can't. Hello, enlarged prostate. Calls up family medicine to send a doc over to the floor to try and put a catheter in. Doc shows up, stares awkwardly at the catheter setup and then tells the RN to call a nurse down from urology. Urology nurse shows up. Doc asks her to put the catheter in. Ask a bunch of stuff about which size, etc. Doctor just says sure, that sounds great, whatever you think, etc. Urology RN gets the catheter in, PT goes pee. All is right with the world. Afterwards in the nurse's station the RN actually looks at the doc's badge. Turns out he's a psychiatrist. RN actually asks him the last time he put a catheter in was about 10 years ago in med school. TLDR, family med sent a psychiatrist to put in a catheter. What was he going to do? Asked the PT how he felt about it. Story 15. I was a nursing student doing my externship in the PACU where patients go after surgery. All the residents were extremely cute, and one day I stopped and chatted with one of them while he was getting supplies. He asked me if I wanted to help him out with a patient. I forgot he was the urology resident and agreed. We head over to the patient. It's an older guy, maybe in his 70s, a little heavy set, with a tiny penis. It turns out that the guy's catheter was filled with blood clots, so I helped the resident irrigate the catheter. Then, the resident says he wants to put in a new catheter. So I'm given the job of pulling the guy's foreskin back and holding his penis in place while the resident tries to put the catheter in. It doesn't go in. We had to try with 3 different catheters before we finally got it to go in. After we're done and we're cleaning up, the old guy is panting and looks me in the eye and says, "Was that as good for you as it was for me?" I was mortified. And apparently he went on to tell anyone who would listen that the pretty young nurse played with his penis for more than half an hour. I was sure that I'd get fired. Story 16. Used to work in endoscopy clinic. Received a medical report that just said found false teeth, removed false teeth, returned false teeth. Not the most amazing story, but made me giggle a fair bit. Story 17. I've been an EMT for 15 years. You pick a TLDR, I'll expand on it. 626 pounds. Full arrest drunk motorcyclist versus guardrail driving while high can kill you. Don't drink and wrestle. Don't drink and punch a snake tank. Keep your DNR with you at all times. College freshmen really need to learn how to drink contact high at a fish concert. Dear diabetics, please eat before having the calls that haunt you. Aren't the nasty or strange ones. ETA. The most tragic story I've ever heard was my mother's. ETA 2. Okay, I'll tell them all. Good thing I'm home sick today. I'll update each of the TLDRs above with a link to the story as I get them typed out. ETA 3. Taking a break to eat dinner. Will return. ETA 4. It's my bedtime, I have to be up early for work. I will work on writing out more of these at work and post them when I get home. Story 18. My mom is an oncology nurse. Irrelevant, and the weirdest thing to happen at her hospital was last year. Year before, who knows anyway. On her way into work she saw that someone had left a morbid-looking display of a person with no head near the entrance. She thought it was really inappropriate for a hospital, as did most of the other workers. Turns out it was a real person who had gone to the hospital entrance and blown his head off in the am. People thought it was a Halloween display for over an hour until someone realized it wasn't a grotesquely realistic setup. I'm at work now and can't find the article, but it was in Fall River, Massachusetts in front of Charlton Memorial. Story 19. When I was a resident I was working the ER one night. This was during the O.J. Simpson trial. They brought a woman in by ambulance that had been stabbed by her boyfriend. I was assigned to work the airway, so I was at the top of the bed above her head. She was laying there wide awake looking at me with a huge kitchen knife, the kind you would cut a head of lettuce with, sticking out of her throat. It had lodged itself in the bone but didn't hit any major vessels. I held her head and told her don't move. She looked up at me, smiled, and said looks like I got OJD doc. She was taken for surgery and ultimately did fine. Story 20. Maggots. If you're thinking hey, that doesn't sound horrible, you are wrong. In nursing school during my ICU rotation, I got to assist in a dressing change for a patient who had necrotizing fasciitis in the abdomen and had spread downwards. And by assist, I mean watching in horror as the nurses went fist deep into this morbidly obese patient's wound trying to get a grip on her flesh. Apparently the patient was diabetic and was giving herself insulin shots without swabbing with alcohol and what I assume being unhygienic overall. If I remember correctly, the nurses were trying to change the wound vacuum dressing. It can be tricky to do, as the sponge needs to be shaped correctly and the clear dressing on top needs to be sealed nice and tight so the fluids can be sucked out. Well, the wound was huge and it went down both groin areas to the inner upper thigh. Add the big stomach flap and it became almost impossible to do with only 2 nurses. That's when me and a buddy were called in. Luckily, I have a strong stomach, but it was a shock to see. I'm sure I have other stories, but I just finished a 12-hour night shift, so it's sleepy time for me now. Story 21. Anesthesia tech here. Training a new girl, daughter of a doctor. Her first day on the job, she was to bring propofol to the doctor, so she had to walk around the surgery that was going on, don't touch any sterile fields, drop off the drugs on the cart, turn around and come out. But on her way out, the surgeon turns around and drops a leg on the table right in front of the new girl. This leg had moments ago been attached to the patient, color drained from her face. Pretty sure she booted into her mask. She quickly walked out and went to the bathroom, and I never saw he again. I still laugh at it to this day. Story 22. 56 years old female comes into the ER during the night shift. Complains of abdominal pain and pain during urination. I give her a cup for a urine sample, comes back with barely 5 ccs. UA comes back normal. MD goes into GYN room to do a pelvic exam on point. MD comes back out and asks me to page urologist. Foreign object in PTS urethra. Point stated that the Sharpie cap came off and got lodged in her pee hole. When MD asked why she did it, Point states for pleasure. Story 23. I had a patient shove a pen into each eye socket all the way so that the points met in the back of the brain and all you could see was the ends like little nubs. He was still able to talk. Story 24. I'm a nursing student, and my professor told us a story of how another student he thought before was traumatized. They were at a veterans hospital and she was told to go check the blood pressure of a patient, but the patient was a quadruple amputee. She left crying and later became a teacher. Story 25. Undergrad student here, but I have done plenty of physician observations. My nastiest experience was during an ER shift. 80-something man comes in from nursing home. Man had previously fallen, after repeatedly calling nurses to no avail, trying to go to the bathroom, and was in a halo brace. This was 5 weeks into his halo brace, and the nurse that was cleaning him at the home noticed he had a bed sore on his back that extended to under the halo. Due to procedure they had to bring him to ER for evaluation. I was actually able to help the doc with unscrewing this guy's halo from his head to be able to remove the chest piece so we could get a look at the back. When we pulled the brace of the attending mutters under his breath, whoa, 40 years of emergency medicine, and I have never seen one this bad. What followed was 1.5 L of gravy-looking pus, which smelled the entire ER for the rest of the 6-hour shift. He cut open part of it and would slowly roll over the other half to keep squeezing out more pus. This guy's bedsore was gigantic, and the doc notified the ethics board and whatever other governing body about neglect on the part of the home. The sight and smell could only be beaten by the comment when we were leaving by the doc. He will likely not live through the infection he will get from this. Those nursing home idiots just handed him his death certificate. Story 26. I was working in a hospital blood bank a few years back. I had finished a routine type and screen on a lady who was in for a routine pelvic mass removal, and the doctor didn't order any units on her. Straightforward, right? I get a call about a half an hour later from the surgeon directly, which is strange. Usually a nurse will call us, asking if ID cross-match a few units for him, just in case on this patient. I send 3 units of PRBCs up to the OR, then another 15 minutes later I get another frantic call from the surgeon saying, yeah, I think I'm going to need a couple more units. I have never moved that frantically around the blood bank in my life, about midway through the surgery, and already 75 units deep. a perfectly healthy kidney comes down to histology. We're all freaking out in the lab, thinking someone screwed up and removed a kidney from the wrong patient. Turns out the surgeon accidentally severed the renal artery on our routine mass removal patient, and the only way for him to stem the bleeding was to remove the kidney. This poor woman ended up going through almost 200 units in about 2 hours' time, between PRBCs, platelets, plasma, and cryo. The more sad part is that because this woman's circulation was so poor during and after this routine surgery, one arm and one leg became necrotic and had to be removed. The patient was only in her 50s, she was lucky to be alive. Story 27 EMT here, plenty of stories, but this one's my favorite. I was doing my normal overnight shift when I got a call for an MHA by local law. For those who don't know, an MHA or mental hygiene arrest is when law dictates that someone must go to the hospital for a psychiatric evaluation due to threatening or actually hurting oneself or others. This guy had been drinking all night, and had threatened to kill himself. Law had found him hitting himself in the head with a clip of 1 steel brads, basically nail gun ammo. Needless to say he was going for a little ride. Oh, and he only spoke Spanish, so I show up and they walk this guy out to my ambulance. They tell me exactly what I just told you, and hand me the guy's cell phone and the brads. I take them and hop into my rig and off to the hospital we go. So now I'm doing my normal psych transfer, and everything is well and good, I thought. Seeing as how it is a 30-minute ride to the hospital we were going to, I decided to do an assessment of the guy for paperwork's sake. I use my app on my phone to ask the questions. Simple yes, no types, everything is nominal until I ask him if he has any pain. He says yes, and points to his head. Confused by how precise he's saying his pain is, I take a closer look, I find a small drop of blood by his temple, and my thought process went as follows: that's fresh blood, but he has been sitting next to me for 20 minutes. That's a small hole. With fresh blood, you know, that hole's pretty small. It looks like one of those nails he had. That's kind of funny, but the only way you could have that is if you, that's fresh blood, that's a small hole. The only way you could get that is if you shot yourself in the head with a nail gun. That's fresh blood. Oh my god, he shot himself in the head with a nail gun. He actually shot himself with a nail gun. At this point I have several things going through my head, so I half pantomime, half scream, "Did you shoot yourself with a nail gun?" To which he replies, "See, trace time," so I just call up to my driver to step it, because now my priority 4 basic psych transport just got escalated to a priority 1P penetrating head trauma. The entire time the guy is completely conscious, alert and oriented, stayed that way while they pulled them out too from what I hear. Story 28 Grandpa found on Christmas morning dead after giving himself a heart attack jacking off that night. Discovered pants down out, with Vaseline still open next to him. Story 29 Long story. So hey race, the TLDR got abandoned by the residents and nurses while putting a catheter in a 80-year-old naked Chinese woman with dementia. She was screaming at me for a while, 5 minutes straight before anyone came back to finish the procedure. Everyone was opening the curtain to look at me, just standing over her and holding her down while she bellowed at me. Most awkward moment of my life. Story 30. I've posted these stories before in this type thread, but here we go again. This teenage boy came in with a split philtrum all the way up to his nose. He was in a lot of pain, etc. Turns out he was riding a 4-wheeler without a helmet and smacked into a tree, but then we noticed he had on a hospital gown from another hospital. So it turns out he was at another hospital, got mad at the wait time, then his dad drove him here. Now here's the funny part. On the gown were these little holes, about 4 or 5, we didn't ask, but figured out it was cigarette burns. He put a cigarette in his mouth while they drove to our hospital, and normally you can hold a cig in your mouth. But since his philtrum was split, it couldn't support it and it fell out. It got a good chuckle out of everyone. As a lowly pre-med at a free clinic, an old black man came in complaining of itching rash on his butt, so we get him to pull down his pants and bend over. The first thing I saw was a bat wing that went to his mid-thigh. He had a big. Then the doc told us to look closer at his anus. Sure enough, warts. So we got this long lecture about how some people will allow in exchange for drugs. That was fun. Another one had a trauma come in, knife wound. This gangsta came in with multiple stab wounds and was pissed off at the world, cursing and whatnot to everyone. So the decision is made, we need to carry him back to operate on him. We are hanging out in pre-op, while the patient is getting ready. Then the patient is wheeled to the OR, while we hang out for a bit longer. We then head a loud yell and commotion, and by the time we round the corner, there is blood on the floor and no one around. We get into the OR and the patient spontaneously started to squirt blood out of his neck on the way to the OR. He ended up having a stab wound in his neck that went all the way through to his spine, chipping it, a lot of blood sewing, vascular surgeons being called in, and about 4 hours later and he was fixed up. The saddest thing I've ever seen right off is when I helped transport patients in a hospital. I had to push an infant crib to get x-rays. Easy enough. Done it 1,000 times. But respiratory and a NICU nurse was coming along, weird, but nothing too unusual. Took this little kid down and found out he was brain dead. He was with 3 older kids, like 12, 10 and 8. Those kids broke apart a piece of furniture that had nails on it, and started to beat the kid. Then after he was laying on the floor bleeding to death, went back to their living room and watched cartoons. We were getting x-rays so his organs could be harvested. Oh, and his eyes opened up more than once. You've never gotten chills until you see a 2-year-old giving you a deathly 1,000-yard stare. And to make it even worse, people coo and oh and ah when you push a crib through the hospital, not knowing this kid was beaten to death. I've posted this before, but it still takes the place as the strangest thing I've ever dealt with. I was shadowing a neurologist at a free clinic, and saw a few patients. The last patient of the day was an older man, probably mid-50s. He started talking to the doctor about some pain in his lower back, headaches, other common stuff. I was starting to wonder why he had scheduled an appointment with a neurologist for this sort of thing. Then his girlfriend called and asked what the doctor had to say about his memory problems. The poor guy had forgotten that he was supposed to talk to the doctor about the fact that he had trouble remembering a lot of things. Luckily, the neurologist thought it was just a case of low oxygen flow to the brain, which is easily corrected with breathing devices, but it was still a very strange experience. Story 31. I work in stores and distribution at our local hospital. Working in ICU, ordering inventory, the code blue cardiac arrest alarm starts going off. I help clear out the hallways expecting trauma team to run through. Instead, about 6 nurses start wheeling out an older woman from the room. The doctor was on top of her, her chest was split open from the sternum, and the doc was massaging her heart. The rest of the team was charging into the OR. Still to this day I don't know if she made it. That was pretty intense. Second case, bum on an electric scooter rolls into ER, says his back hurts. He changes and lies on a stretcher waiting for the doc. He stinks, as in reeks, easily the worst stench I've ever encountered. Imagine month-old sweatshirts mixed with rotting flesh. So the doc and a couple nurses check him out. They roll him over and his back and buttocks are covered in maggots, eating away at bed sores that he got from never moving. Doc thinks about leaving them to clean wounds, ends up removing them himself. Nurses take the stroller outside and throw on hospital-grade cleaner. The maggots squirmed out of the medic hair like spiders out of an egg, gross as. Story 32. My mom worked behind the secretary's desk in a large hospital. She usually just had to direct appointments to the waiting room, but there were always emergency patients to take care of. One night, a woman walked up to the desk with nothing but a backpack. She had wrapped her arms around herself and just stood at the desk, with an ear-to-ear grin and wobbly legs. My mom looked up and said, "Can I help you?" After a long pause, the lady mumbled, "I talked too much," and waltzed on into the waiting room. After 10 minutes, a man walked out of the waiting room and said, "There's a lady on the floor in there," and walked back in. My mom hurries in and sure enough, Mrs. Backpack is on the ground with an open bottle of Advil next to her. As my mom walked up to her, she groaned, "I took too much TLDR, never mumble when you OD."